Praise the Lord. We are finally at our COVID-19 vaccination roundtable. You're welcome in the mighty name of the Lord Jesus Christ. We've much anticipated this meeting, and I am just as excited as you are. We pray tonight that the Spirit of God and, of course, the knowledge that God has given to mankind at our time will prevail and empower you and I to make the right decisions concerning the dilemmas and debacles of our time. You are welcome in Jesus' mighty name. This is Glory House, where greatness is released, destiny is fulfilled, and miracles happen on a daily basis. You are a miracle of God, and this year we know that we are going forward. I couldn't wait till the service start today, because we're talking about something very different from what we would normally do on a Wednesday word service. Today we have a distinguished panel of professionals in the medical field who will be talking to us and addressing 1,001 different questions about the COVID-19 pandemic, and also, more importantly, about the vaccination. You and I know about the various conspiracy theories and all the things that are out there. There are millions of comments, opinions, blogs, write-ups, all kinds of things. So it's like, how do I navigate my way in a time like this? And I'm going to start with a Bible passage that says in Proverbs chapter 4 from verse 7 to verse 10, it says, "Wisdom is the principal thing, and with all of your getting, get wisdom. In all of your getting, get understanding. It will exalt. If you exalt her, wisdom and understanding will promote you and will bring you honor when you embrace her." In verse 3, in verse 9, it says, "She will place on your head an ornament of grace, and a crown of glory she will deliver unto you." More importantly, in the 10th verse, it says, "If you get wisdom and understanding, hear my son, and receive my sayings, it will make the years of your life many." So wisdom is a defense. It's a way to go in the times in which we live. Congratulations. It's so happy. We're glad to have you wherever you're viewing, in the United Kingdom, in London, in Africa, Asia, in South America, wherever you're viewing, you're welcome in Jesus' mighty name. Well, I think we should just get straight into the business, and it is my great privilege and honor to introduce our guest panelists tonight. So let me start. They're all medical professionals. It's amazing, and I'm just so excited about this. So let's do the ladies first thing, and let me introduce first and foremost Dr. Ronke Olukani. She's a lead GP at Tilbury Chadwell Medical Center. She is a care thing for care home GP. She's the care home GP for College Health, and also clinical supervisor for Care Home COVID-19 Vaccination Center. You are welcome, Dr. Ronke, in Jesus' name. It's an honor to have you as one of our panelists today. I also want to introduce a medical doctor and clinical pathologist. His major discipline is in clinical virology. He has a specialized interest in vaccinology and drug safety, a lecturer at Sefakao MacArthur University and National Health Laboratory Services in South Africa. Please welcome with me the distinguished also Dr. Tayo Famoroti. You are welcome, Dr. Tayo, in Jesus' name. Thank you for joining us. Thank you. And we also have with us a medical doctor, GP principal and clinical director, Tilbury Primary Care Network of the NHS. He's a clinical director with the College Health Limited, and is also clinical lead with the Chadwell Local COVID-19 Vaccination Center, and has vaccinated and participated in vaccinating almost 20,000. Please welcome with me Dr. Chris Olukani as well. You're welcome, Dr. Chris.
Thank you, Pastor.
Good to see you. And you all look all good to go tonight. We also have, of course, not the last, but certainly not the least, a medical doctor as well, and community pediatrician of well over 20 years of experience. He's not a novice, he's a specialist member of the Bromley Local Research Ethics Committee and worked as a specialist in the Bromley Immunization Clinic for years. And he's with us tonight. He's giving us of his time. Please welcome Dr. Wale Oshoba as well.
Thank
Amen.
you.
Thank you so much, Dr. Wale, for joining us. Welcome, our distinguished panelists today. I'm going to try and be kind and gentle with you, but all the questions that people will send in tonight, I am going to thrust them at you as honestly and sincerely as I can. And if you're viewing, you're watching on YouTube or you're watching on any of our platforms, you are invited. Please click share, click like, and post it all over the world and all over the United Kingdom. Somebody will be tremendously blessed by this program tonight. You don't often get this kind of distinguished guest to speak to you all in one go. So please share it around family, friends, neighbors, and the people who you know on social media as well. And as you do so, if you have any comments, any questions, remember to send them in on the chats or send them by email q&a@gloryhouse.org.uk. Keep sending in your questions. We will try and answer as many of them as we can to set the ball rolling today, because we have so much we would like to do. I'm going to put one of you, our panelists, on the spot. And I'm going to ask for some kind of brief history. Would you be kind to talk to us for a few minutes, just 1 or 2 minutes, on the history of this so-called Corona-19 virus, its transmission? How does this even work? Is it actually true? Can you talk to us about how the vaccine is even manufactured or not manufactured? What's this all about? And can I invite Dr. Tayo to speak to us for a few minutes? You're welcome, Dr. Tayo.
Yeah, thank you very much for having me. It's actually wonderful that we are trying to correct the misinformation, the disinformation, and address issues about the conspiracy theories that are floating around. Based on data and also the history of COVID-19, it started in Wuhan in China in 2019, but so far we are not so sure if it's really the origin is actually from China in Wuhan, or it was brought in from outside and spread in Wuhan, China. And that's one of the reasons why the WHO sent the experts, I think in the last 1 week or two, they went to China on a fact-finding mission. So it's a coronavirus. Viruses have different families, different, and under the coronavirus family, this COVID-2 belongs to that family. There are other viruses in that family too. We had MERS-CoV, that was a while back, which stands for Middle Eastern Respiratory Syndrome, and we also have the SARS-CoV-1, which also happened. The MERS was in Saudi Arabia, and the SARS-CoV-1 was the first SARS outbreak we had. So most of these viruses I've mentioned are via respiratory infections, and the primary reservoir sometimes could be in bats. But in this instance, like I said, there's ongoing research to find out where it came from, how it became, how it got transmitted from Wuhan, China. So the primary means of transmission of this SARS-CoV-2 is via the respiratory droplets or aerosols, and that's where you can get it through your airways, through if you your eyes, conjunctiva. And so far, initially, after the outbreak, in the first few patients where they had classical respiratory signs and symptoms, just like your cough, sore throat, fever, loss of taste, loss of smell. But as time went on, it was actually discovered that not everybody who had SARS-CoV-2 infection had a classical respiratory infection. Some, the first time they were diagnosed, they had psychiatric illnesses, just acute psychosis. Some had, blood dyscrasias, blood issues. Some just had joint pain. So there's an evolving I mean, it's the signs and symptoms and the presentation is actually evolving. So now, and that's why one of the diagnosis criteria has been changing over time in terms of SARS-CoV-2. And lest we also forget, this is not the first pandemic we've had in human history. This is not the first time. We've had more than 5 types of pandemics. We've had the Black Plague, and even in recent times, in 1918, we had the influenza pandemic, where millions of people died. I'm sure, I mean, most of us were not born by then, but the history book shows that people died. People were asked to mask up, even during that time. So this is not the first time that there will be a pandemic and there will be a global approach to dealing with this pandemic. And looking at the issue that has actually taken global stage now in the last couple of weeks or months is the issue of vaccines. I mean, we've had lots of vaccines, from the polio vaccines, the measles vaccine, the rubella vaccine. There's a lot of vaccines that are out there that, are part of the EPI programs in several countries. I mean, even HIV vaccine is still being researched upon. And so people are always like, so why COVID? It was so quick. Yes, it was so quick. Don't forget, when did we start flying? I'm sure the time planes were being, produced, people were like, no, I'm not going to get into that. It's going to fall out of the sky. Yeah, we do have plane crashes. We're not going to dispute that. But these are far in between, one out of several thousands of flights taking place every day. So, and there are different methods of making vaccines, just like we've evolved from the jets of the World War I to World War II. And now in 2021, we have super jets that, can fly all over the world without even refueling. So there are different ways of making vaccines. We have the classical way, which is the live vaccines. It uses a live virus. They attenuate it. Attenuate means make it weaker, but can still cause the same infection the real vaccine will cause. And the main thing they do is to prime your immune system, to give it some form of memory. Another one is the inactivated vaccine. With the inactivated vaccine, it's killed. So whatever causes infection, the genetic material itself is killed. And it also, but the only difference is it doesn't contain all the genes or all the proteins that the real wild virus will have. So you may have to give the person booster doses regularly or multiple doses. And after that, we also have vector vaccines, vector recombinant vaccines, just like the AstraZeneca and the Johnson & Johnson vaccine, whereby we use a vehicle, we package the genetic material of the virus, not the total genetic material. What we do is we take a bit of the genetic material of this virus, which the body responds to, which the body's immune responds to. So we just take a bit of it, not the whole thing. We put it in that vehicle, which we call the vector. In this instance, in the AstraZeneca and the Johnson & Johnson, the adenovirus vector was used. Then the other one is the new one, which is the mRNA vaccine, which, because the name sounds like mRNA, sounds like it's some form of DNA, people have this skepticisms about it that maybe it's going to change our DNAs. So we have other methods of making vaccines. They have their advantages, disadvantages. Like the mRNA vaccines, you need to keep them ice cold, minus 70 degrees. So that's one, could be one of the disadvantages. And with the vector base, you may need to actually prime them and boost doses. And that's one of the things that, it's about the vaccine. So if we look at the vaccine, why do we give it? Then the question is, why shouldn't we give it? There's no cure, there's no treatment for COVID, and people have died in their millions globally. People are sick in the UK, in Africa, in Europe, West, East, North, and South America, and Asia, and Australia too. People have been sick, and businesses have been closed, schools have been closed, people are working from home. We no longer engage as we used to. Churches are being closed. Churches, religious organizations are being told this is the number of people that should be able to congregate at a certain time, at a fixed point in time. And that is not what we are supposed to do. As Christians, we are supposed to fellowship with one another, not just digitally, but even as we congregate one with another. But we've not been able to do that because there is no treatment. Now we have the vaccine. And one thing about vaccines generally is they are very safe. Safety is paramount while they are developing vaccines. And they also check for efficacy. And before vaccines are licensed, regulatory authorities looks at data, they check for the safety and efficacy all at each stage. We have different phases of vaccine and also drug development, and all these phases need to pass. If you go into data, you find out that the few ones that have been licensed so far are not the only one. We have over 200. Some have already failed. They're never going to see the light of day. But it just goes on to tell you that vaccines go through rigorous scientific phases before they are licensed. And I think at this point, I would like Dr. Ronke Olukoni to actually go into details and give us some insight into what has been going on in the UK in terms of the effect COVID has had on the economy, on lives, and the healthcare sector in the UK. Thank you. Over to you, Dr. Ronke.
Thank you very much, Dr. Tayo, for that introduction. Thank you, Pastor, for having me on this panel today. I don't take it for granted. I consider it a privilege to be here to share knowledge and to educate our people and to give them a better understanding of what is happening with the COVID virus pandemic infection and the vaccines itself. Dr. Tayo has very kindly explained to us about viruses and the vaccines and the formation of the vaccines. And we know that we've had a lot of conspiracy theories talking about how the virus is not real, or it's this, is that. Like in the introduction, we were told that I look after care homes. I mean, I've been doing that for a few years now, and we know that people in care homes, in nursing homes, they are generally old people. They are generally people who have a lot of underlying conditions, and we know that they do die. But I can tell you firsthand that with the pandemic, the death rate has been unprecedented. I've had numerous care homes losing up to half of their residents with this COVID-19. When the first peak happened, one of the care homes lost about 18 people, and they were literally dying one after the other. So the virus is very, very real. So don't let anybody fool you and tell you that it is not. So I'm just going to give us some statistics with regards to what the infection has been doing, mainly in the UK. So to date now, since the virus was identified in 2019, in the UK, we have had 4,188,400 people test positive for this virus. We've had the number of deaths, 123,296 deaths. And these are deaths that have had the patients or the people testing positive for COVID-19 within 28 days of their death. And death has been reported in sort of different ways. We have higher numbers of people who have had COVID-19 mentioned on their death certificate, and that number is 140,062. And people have argued that, people probably would have died anyway, so they're just making up the numbers. But this has actually been looked at, and they found that excess deaths, those are the number of deaths over and above the usual number that you'd have expected, was 122,348. So the COVID virus is real, and it is killing people. Also, currently in the UK now, we have in hospital people who have been diagnosed with COVID with one form of illness or complication or the other, 12,748. I mean, the numbers are coming down, but the numbers are still very, very high. Just to give us, a brief comparison of the number of deaths that have occurred so far. I mean, in the US, they've had 510,900 people die of COVID, or had COVID mentioned on their death certificate. But when you actually look at it, because the UK has suffered quite a lot with COVID, and In the US, you find that the death rate is actually 156.2 per 100,000 people who have died of COVID. But in the UK, that number is actually higher, 183 per 100,000 people have died of COVID. So it has hit the UK quite hard, and it is a real disease. So I'm just going to talk briefly about numbers associated of people that have been vaccinated. So to date now, in the UK, we've had 20,478,619 people have received the first dose of their vaccine, either the Oxford, AstraZeneca, or the Pfizer vaccine. But unfortunately, which is one of the reasons why we are sitting down and having this panel discussion today, we found that the uptake of people in the BAME community, and that's the Black, Asian, and minority ethnic group, is much lower compared to those of their white counterparts. And what some GPs have actually found is that with regards to not coming, missing their appointments that have been booked for them to have the vaccine, we found that it's 10 times higher in people in the BAME community, with about 20 to 30% of missed appointments compared to 2 to 3% in the other groups. I'm just going to give you a quick breakdown also of the number of people that have been vaccinated. So I'm using some data that I got from the Royal College of General Practitioners website, and it's used the 2011 census to check the population of the different ethnic groups in the UK. It says that 85.5% of people, according to that census, are white, and 85.5%, compare that to 90.6% of people have been vaccinated that are actually white. And then when you go to the mixed ethnic, mixed race, 2.3%, they represent 2.3% of the population, but only 0.8% of the mixed group have actually been vaccinated. Now, the Asian community represents 7.8% of the total population, and they, out of the number of people that have been vaccinated, are 5.3%. But the black community represents 3.5%. I think that we are probably a lot higher than that now, but based on that census, 3.5%, and only 1.7% of the total number of people that have been vaccinated have been black. So it's obviously a problem, and we're hoping that today that there would be information and education so that people can, look at this quite critically and know that it is safe to have this vaccine. Back to you, Pastor.
Thank you so much, Dr. Ronke. Wow, that is just amazing. The figures, and we have a whole lot of questions that people are sending in to ask. And I know we won't have a lot of time, maybe a minute or two, or half a minute, just to answer the questions. I think by answering questions, we'll be able to address people's concerns. So I'm going to go with the first question that says, does the United Kingdom government have any plans to vaccinate the population? And if so, what are those plans? Maybe I should ask Dr. Chris that one. Amen.
Thank you very much, Pastor. The Bible says that my people perish because of lack of knowledge. I look after possibly about 60,000 patients in 7 practices across 10 different sites. And I have seen whites, blacks, young, old, people with medical problem, people without medical problem. I have seen Christians dying. I've seen non-Christian dying. I've seen people of different races dying. Hence, we need to pass the right information to people to know exactly what is going on. The governments have made a good plan to vaccinate the population, and we need to have an understanding of what this is. The priority is very, very simple. We need to prevent death. There have been too much death, like Dr. Roque have said. So we need to also maintain the health and social services. We need to keep them going. They are the oil of the economy. So we need to keep that going. And the parameters is based on one, age, and two, medical disease. So you've got the over 80 and the frontline health workers that have been vaccinated. And if you're there, you're listening to me and you've not been vaccinated and you're part of this, you've got to call your GP. You've got to get yourself vaccinated. We also have the residents in care homes for the older adults and their carers being vaccinated. You have the over 75 years of age being vaccinated. The cohort 4 are the people that are age 70 and they have clinically extremely vulnerable people. They have been vaccinated as well. The cohort 6, 65 age and above, they are being vaccinated. And now majority of centers, we are now on all individual 16 years of age to 64 years of age that have underlying condition, health condition, respiratory problem, asthma, hypertension, cancer, whatever it is, they need to be vaccinated. You need to call your GP. You need to get yourself vaccinated. Can I also say that if you've got sickle cell disease, you know definitely that it's almost difficult for you to have a good supply of oxygen with COVID virus. You've got to get yourself vaccinated. There is no doubt about it. If you're diabetic, if you've got kidney disease and you're on dialysis, you've got to also get yourself vaccinated. To get yourself vaccinated is not difficult. You need to call your GP. You need to respond to text messages. You need to respond to the emails that are being sent to you, the letters that have been sent through your post door. Don't bin those letters. Call the numbers that you've been given and get yourself vaccinated. Thank you, Pastor. Over to you.
Thank you. Having said that, Dr. Chris, and thank you so much for that. But having said that, the thing about it is, I'm going to throw this question perhaps at Dr. Tayo. A lot of people are saying that the vaccine was rushed, and I know he alluded to it. Just for 30 seconds, Dr. Tayo, people are saying the vaccine was rushed. Now, Dr. Chris is saying you have to get yourself vaccinated, but people are saying the vaccine was rushed, and normally it should have taken years. Now it's taken months. Therefore, are these vaccinations not really unsafe? Is there any truth to that, Dr. Tayo? Even if it's just for 30 seconds, can you speak to that? Considering Dr. Chris is saying we should get vaccinated.
All right. Yeah. I would not use the word rush. I think a better word will be it was made in good time rather than saying it was rushed. Don't forget, I mentioned the word HIV earlier. We're still waiting. I mean, people are complaining already that HIV has taken years, and we still don't have a vaccine. But that's the story for another day. These are two different viruses. The way they cause disease is different. Their variability is different. So like I said earlier, the planes from World War I are different from World War II to World War III. Now we can sequence the human genome. Before it could take us like 8 months or longer to sequence the whole human genome. Now, in 2-3 days, we've done it. We can do it. So it tells you technology has moved from what it was 20, 30 years ago to what it is now. So we can quickly sequence things, genomes. We have a bank, just like, you have your HSBC, I think, in the UK, a bank. We have a bank where we keep all those genomes. And so when you sequence, you just put it in the bank. If you do not find a replica or something similar to that genetic material, then, you can easily say, most likely this is a new virus. So we have a gene bank, and we have a system put in place where we can biogenetically engineer things and quickly mass produce them. And that's what has happened with this COVID virus vaccine. Wow. Yeah. So there's nothing rushed about it. It's just, it was made in good time. And the regulatory authorities, we have the FDA, the European Union has the EMA, in South Africa here we have SAPRA, you know, they're also in this whole thing. They make sure the vaccines are safe. They just don't rubber stamp. They make sure it's safe. They look through the data to see if it's the efficacy is as good as the market authorization holders, as the producers claim it to be. So it was never rushed. It was just made in good time because technology has moved from what it was almost 100 years ago. Yeah,
wow,
so we're moving. This is the jet age, like they call it.
Thank you. And coming from a virologist, that means a lot. Dr. Wale wants to add something to that. Would you kindly do so, Dr. Wale?
Yes, thank you, Pastor. We now know this sneaky virus who's taken a life of its own is no respect of persons. One thing I'd like to add is that speed in producing these vaccines was not sacrificed for safety at all. A lot of processes were done in parallel. So as data was being completed, that was submitted to the authorities to review. If I could say, unprecedented amounts of money and resources were put aside for this. As a member of the Research Ethics Committee, which I've been many years ago, for 5 years at least, we only met once every 2 months. And if your research paper wasn't approved, you have to wait for the next batch to come along. But in the pandemic, what happened was that you put in your research paper in the morning, by the evening, you're getting approved. A lot of people, research subjects, were doing nothing. They were at home. So, you know, speed, yes, it was important. And like Dr. Tayo had said, the technology was already there. The technology was even being used, actually for one of the Ebola vaccines. And technology also, that same technology was being used for cancer drugs. So it wasn't rushed at all.
Oh, that's quite assuring, Dr. Wale. Thank you so much. That's really reassuring. There is a question here which I probably would direct back at you, Dr. Wale. Somebody is saying, why is it that Blacks, Asians, and Mid-Easterners and so on seem to be more susceptible to COVID, the infection, than our Caucasian brothers and sisters? Is that a fact? And if so, just in a few seconds, what do you have to say about that?
Thank you. That's an interesting question. All lives matter. Blacks, Asians, whites, children. I've seen babies suffer with this disease. Has been an involved new disease called PIMS in the UK, pediatric inflammatory multisystem syndrome. Also coined multisystem inflammatory syndrome in children in the United States. However, we realized very quickly at the start of the first peak that Black, Asian, and minority ethnic groups were more at risk to this disease, perhaps 4 times or more. BAME group members would test positive for the virus. And in ICU, those that were in the intensive care, 1/3 of the patients there were from the BAME community. That compares with, say, 14-15% of BAME population in England and Wales. But not only that, we started noticing that the first few doctors, NHS doctors, the first 10 at least, that died from COVID were BAME doctors. That compares to 20% of NHS staff overall in the community that are BAME. What were the variables or determinants for this? A lot of theories were thrown, but it was scary when, of all NHS health care workers that died, 63% were from the BAME community. But certainly comorbidities, heart disease, kidney disease, diabetes mellitus, increased blood pressure, morbid obesity. So if your BMI is over 30, you're more at risk. Also, key workers, most of the key workers were in the front line. We know that 25% of Transport for London workers were from the BAME community. There was also the idea that overcrowding, yes, I think overcrowding might play a part, but that's not the only part, because a lot of the doctors that died were not living in overcrowded areas. So there was complex mix of problems that were comorbid to this disease.
Oh, wow. Thank you, Dr. Wale. Thank you so much. I know there's just so many questions that we have in front of us today, and I know we'll try and answer as many of them as we can. I'm going to throw this one at Dr. Ronke. The question is very simple. Some people think I'm healthy, I'm fit, I have no medical underlying condition, so do I really need to take the vaccine? What would you say to somebody like that?
Thank you, Pastor. Like Dr. Wale just said, we have different groups of people, different classes of people being affected by the virus. And it is true that if there is an underlying condition, people are more susceptible to serious illness and to death. But we have found that quite a lot of people with no underlying medical condition, people that are not old, have got the virus and they've ended up in ICU, they've ended up dying from the virus. So yes, my answer to that person would be, please take the vaccine. Even if you are fit and healthy, take the vaccine, because you may end up getting the virus, and unfortunately, you may end up having very serious illness with it and may even end up dying. So if there is a vaccine that can prevent that, then you should definitely take it. The other reason why you should take it is if you do get the virus and you don't end up having serious illness or death, you could then be the one to pass it on to someone who is more susceptible, and then could be the reason why that person will end up being very ill, and getting complications from COVID or even dying. So yes, please go ahead and take the vaccine. Thank you.
I'm not going to let you go yet, Dr. Ronke. I'm looking down at my screen, I'm looking at you, and looking at the questions. I'm not letting you go yet, Dr. Ronke. I'm going to throw another question at you, which is on my table. Somebody says, Dr. Ronke, actually specifically Dr. Ronke, have you, as a doctor, as a frontliner, as a mother, as a wife, have you received the jab? The person says, and if you have received the job, did you experience any side effects? What general side effects should a person expect if they take your advice and take the job?
So yes, I have taken the vaccine. I took the Pfizer one because that was what was offered to me. I didn't ask for any specifically. And funnily enough, the day that I took it was a Thursday. I was at work. I had an appointment booked for me. I finished my morning session. I drove to the center. I took the vaccine and I went right back to work. And I worked till 6:30 and then I came home. Side effects. I didn't really experience a lot of side effects. I mean, I had a little bit of ache in my arm. Usually the vaccinator will ask you which is your dominant hand, and then they put it in the other one. So I'm right-handed, it was put in my left arm, and didn't really have much. I finished work, I came home that day. I think I still cooked that day as well when I got back home. So yes, I was fine apart from the side ache. Now, yes, you can have side effects, but side effects are not many. And even if you do get them, they usually resolve within 1 or 2 days. So you can have side effects at the site of the injection itself, where the needle goes in. And those side effects include things like pain at the sites, a little bit of swelling, a little bit of redness, and they usually appear within the first 7 days of you getting the vaccine, and they usually resolve within a few days, 1 to 2 days. Some people decide to take paracetamol, even if you have a little bit of pain, but I hate taking paracetamol unnecessarily. So I didn't take anything, even though I had slight pain. But you can take that if you want to. You can also get generalized side effects, things like feeling tired, feeling a bit headachy, having joint pains, maybe a little bit of fever. But like I said, the side effects are usually quite mild. A lot of people have no side effects at all. And even if you do get them, they usually resolve within 1 to 2 days. Thank you.
Thank you. Thank you for being on there. Sorry for putting you on the line, Dr. Okay. I have a question, and I think I'm going to go to Dr. Wale for this, seeing that you're a pediatrician and you work a lot in the community apart from research. Somebody's thrown in a question. There's been a lot of talk about a certain, I'm not going to say what exactly they call it, but there's been a lot of talk about a thing called luciferase. And they're saying this inbuilt sort of vaccine tracker, whatever it is that not the mark of the beast? What do you have to say about that, Dr. Wade?
Well, this is an interesting one. The social media is awash with lots of conspiracy theories. And just to, in a short way of answering this, luciferase is an enzyme. You also, and there are different types of luciferase enzymes. You also have luciferin, which is a substrate. Now, the enzyme reacts with the substrate, and the chemical reaction produces illuminescence or light. Luciferase has been around pre-COVID for many years. It's used in research. It's definitely have been used in early stages of development of vaccines. What is luciferase? The firefly luciferase, firefly luciferase gene had been isolated for many years, and that's what they use in developing these assays that's been used in the lab. Now,
the firefly, sorry to interrupt you, the firefly, do you have
an image coming up shortly, if we could see that, right? So okay. The firefly is an insect. All it does in the toilet is to release these enzymes to produce light, bioluminescence, and attracts mates during the twilight season. There are other bugs and even whales, some fishes, that does the same thing. Now, fast forward to 2020, 2021, the word Lucifer is a Latin word, and it means light bearer or light bearing. And we know from the Bible that he's a fallen angel. And so people put 2 and 2 together and think that's what they're referring to. It's not. It's completely different.
Thank you. That's quite reassuring to know that you can get the vaccine and not lose your eternal salvation, because I think that is a major concern in different parts of the world, to be honest with you. I have a question here, and I'm very conscious of time. I really want to get us through as many questions as we can. I have a question in front of me that says, once a person is vaccinated, and I'm going to throw that again at you, Dr. Wale. Once a person has been vaccinated, does that then prevent them from getting infected or from transmitting COVID-19? How does this work?
Yeah, so once you're vaccinated, it prevents you getting severe disease. It will prevent you dying, certainly. most of the vaccines are more than 50% efficacious. That means they will do the job that's under 10. So you will be protected from that. However, the jury's still out about whether the vaccine prevents transmission. Reassuringly, there's been some new research from Cambridge hospitals. What they did was test staff that were already vaccinated, and they found that out of those that were vaccinated, only maybe 4 out of 1,000 got positive test, whilst those that had been unvaccinated, perhaps about 17% were showing positive. So what it means is that we still have to keep to the hands, face, and space measures in trying to prevent transmission.
So even though you've been vaccinated, you should still do the usual things which should be done. Dr. Tayo, I have a question for you. Is there, since we're talking about the vaccination in this way, is there any possibility, no matter how remote, that a person can actually catch COVID-19 by being vaccinated? Is it possible?
It is not possible because what the vaccine, the biological component of the vaccine is not the whole genomic material of the virus itself. So it's just a small part of it, which actually codes for the spike protein, because that's the part that our immune system responds to. So it is not possible that a person who is vaccinated will get COVID infection. And like Dr. Wole earlier said, I'll just want to add this to it, that there's a difference between infection and disease. You may have an infection, but it doesn't always lead to a disease. Sometimes you have an infection, is aborted, then you don't develop a disease. So if you get a vaccine, it does not cause COVID infection in any way. Wow. Thank you.
Can you, Dr. Tayo, without being funny, can you repeat that? I think all of our audience need to hear that. Can you just repeat it as a virologist? This is your profession. You're qualified, very highly qualified. Could you repeat that in 5 seconds?
I would like to repeat again. If you get the vaccine, there is no way it's going to cause COVID infection. Whether mild, moderate, or severe, there is just no way. It's just a part that codes for the protein, and it's given, inoculated as part of the vaccine, and the body now develops some form of immune response to it, so that when you now get exposed to the real wild virus, your body just goes into overdrive to knock off this invading virus.
Thank you. You should get an award for that, for just saying that. I'm going to double back again to Dr. Roque. I have a question here, and I picked it out because I thought this is really interesting. The question is, why is the vaccination an injection? Some people just cannot stand injections. Why don't they have a tablet or a capsule that we can swallow instead of an injection? How do you respond to that?
Okay, so the vaccine, like a lot of the COVID vaccine, like a lot of other vaccines, is an injection which has to be injected into the muscle. And one of the main reasons for that is so that the vaccine can actually do what it's supposed to do. And like Dr. Tayo just explained, he says the way you get the vaccine, it's a component of, or a part of the virus, not the whole thing that would cause the disease. So it goes in and is injected into the muscle, particularly because the muscle has a lot of blood supply, a lot of vessels there. So it can take the vaccine from the injection site into the bloodstream and get it to where it needs to get to come into contact with the cells in our body that help to fight infection. And once it is exposed to this, then it can start to form the antibodies, which are the substances that help to fight off infection and get the body ready for when it comes into contact with the real virus. So the reason why it is injected is so that it can do that, rather than swallowing the tablet and then it goes down into your stomach, it gets dissolved, and it doesn't actually get to those cells that it needs to get to do what it's supposed to do. And yeah, so that is one of the main reasons why it is a tablet. And some people may also
not
want
a tablet, it's an injection.
It's an injection, yes.
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 Thank you.
Yeah.
Go. Were you done, Dr. Okay, please finish. Please
yes,
finish.
I was going to say, because some other people might also want to know, well, why is it injected into the muscle instead of being injected somewhere else? Like I said, into the muscle, because the muscle has got a lot of blood supply, so it can move quickly, and also into the muscle because when it's injected into the muscle, you have less serious side effects as opposed to it being injected into other areas like in the fatty tissues where it can actually cause an infection. So it goes into the muscle mainly, one, so that it does exactly what it's supposed to do, and two, so that you have less serious side effects to the injection. Thank you.
Thank you. I'm going to go straight into... Were you going to say something, Dr.
Yeah,
Wale?
just to add to that, there were over 100 vaccines being manufactured at the very start of the pandemic. Perhaps just less than a dozen have been or are in the process of being approved. But just this week, there's news that Intranasal, so these are vaccines that can be given through the nose, have gotten approval for phase 1 and 2 trials. So just like you have the flu vaccine that you could spray up your nose, they're developing that. So that would be good news for a lot of people.
Thank you. Thank you very much. So, but that doesn't mean, Dr. Wale, I'm sure you're not saying that people should wait until the nasal one is approved if they can get the vaccine now. I'm sure you're saying what you said about that. Should we wait till the nasal one is approved?
Absolutely not. So you get the vaccine that has been approved and that's been offered to you.
Thank you. I'm going to go straight on to something else that's quite interesting. I have a question here. It's a bit of a different perspective. Somebody's asking, I've read that the vaccine affects fertility, and that some even suggest that it's a deliberate deep state conspiracy against ethnic minorities. Dr. Roque, what's your take on that?
I'm not going to spend a lot of time on that question. The answer is no. It does not affect fertility in any way. There is no evidence from all the research that has been done to show that it affects fertility in any way. So that is just one of these other conspiracy theories that people are putting out there with absolutely no basis, no evidence at all. Thank you.
Okay. And then Dr. Ronke again. Sorry. Why are pregnant, if it doesn't affect fertility, you have to ask, somebody's asking, why are pregnant women and children, at least below a certain age, why is it that they are being told not to take the vaccine?
Okay, so like a lot of people have said on this panel already tonight, that the development of vaccines, there are two major things that you look at. One, is it effective? And two, is it safe? And the only ways that you can get that is from data from trials. Now, with all the two approved ones that we're using currently in the UK, both the Pfizer and the Oxford AstraZeneca vaccines, they haven't had those trials in pregnant women, and therefore they do not have the data to support that it is safe and it is effective. Therefore, they've advised that it should not routinely be offered to pregnant women and to children. So that is the reason. But as we speak, they are conducting trials and we'll be getting information very soon. So that is the only reason why it's been said, don't give it to pregnant women, don't give it to children under 16, because there is no data to show that it is effective and it is safe. But the trials are going on and the data will come soon.
What age, Dr. Ronke, what age children and 16,
below 16. So 16 and above. Yes. So below 16 is not advise now because of the lack of data, and then pregnant women as well.
Thank you so much. There's also another question, Dr. Chris. I'm sure you can do this. Somebody says, I've already had COVID-19. I had the illness, the infection, and thankfully I recovered. So why do I need to get vaccinated? Do I not already have antibodies?
Thank you very much, Pastor. It's a very interesting question, and a lot of and data have shown that for people that have had COVID infection in the past, the immunity that they were able to booster do not last that long. So compared to those that are actually vaccinated. In fact, there is a particular one that was done in Oxford that shows that people that have had COVID infection in the past, their immunity or antibodies, when tested after about 3 to 4 weeks, considerably reduced to about 40 to 30%. Okay, and when you compare that to those that are actually vaccinated, for the first dose, that have almost about 60% of antibodies, and with the second dose booster taking it to almost 95%, then you'll be able to compare to the fact that, look, because you've had COVID infection in the past, do not actually confer that immunity that will last long. I, in particular, have had patients that have had COVID infection more than once, okay, twice. In fact, a particular patient of mine was 45 years old, elderly patient, actually landed in ITU because of second COVID infection. The first one, it was completely fine, and the second one came just about 6 to 8 weeks after, and he ended up in ITU. So we know that vaccination confer a better antibodies and response compared to previous infection.
Oh, wow. Dr. Tayo, you were going to say something in addition to that.
Oh, yeah, thank you. So another reason is during, research and, drug development, vaccine development, because of ethical reasons, pregnant women or very young children are not included in this research, types of research, like I said, because of ethical reasons. I mean, the woman is pregnant, the child is young. Then another reason is, another thing that's actually been documented so far is with all this licensed vaccines, some people got pregnant, by error, by mistake, and nothing untoward happened to during the pregnancy. The kids, the babies were born well, they were fine. And so, like here in South Africa, I mean, it's not licensed, but you are supposed to consult with your healthcare worker. You have to have like a risk stratification. So imagine you work in ICU, COVID ward, you're pregnant, and there's no way they can move you from that unit to another unit, which is less risky for you. Then you may want to consider. But for now, like Dr. Ronke said, it's not in the package insert of the manufacturer for pregnant women. But like I said, even those who got pregnant after getting the vaccine during the trials, there was really nothing. And like you said, there's research going on in pregnant women to see the safety, and also in children. So I can't remember which of the vaccines. There's ongoing research to look at the safety, not the efficacy. The efficacy has been proven, but the safety in the young ones. And like Dr. Bodwin also said, the vaccine's immunity has, it's been, the data is showing that it has more strength, better depth and breadth of immunity as compared to natural immunity. And just this evening, the South African strain has actually shown to produce antibodies that can neutralize the other strains. So I think that's a good one for, I mean, for the South African strain, if because it produces better neutralizing antibodies, but it still does not stop the person who's been infected to still get vaccinated because of the strength, the breadth, and the depth of the immune response from the vaccination. Thank you.
Thank you, Dr. Tayo. And before you go on this one, I'm going to throw another one at you. For example, somebody says this vaccine was developed, it is being said, to control the general population. So some people are saying that either through some kind of microchip tracking or nanotransducers in our brains. So somebody's been reading some real serious stuff here. As a virologist, doctor, what would you say?
My response would just be like what Dr. Ronke Olukani just said. It's a no. So there's no point entertaining such conspiracy theories, which is feeding misinformation and disinformation. We have regulatory authorities involved. So it's not like people just make vaccines and they ship it into different countries and they start vaccinating. The EMA is strong, the FDA is strong, and they are all independent bodies. They are regulatory bodies, and it's a no. It's not what's happening. It's totally a no. Thank you.
Thank you. Can I ask, this is now Pastor Albert, can I ask all of our panelists, Dr. Chris, Dr. Ronke, Dr. Wale, and Dr. Tayo has already affirmatively said so, but can I ask you in 2 seconds to affirm that you do not believe it is not true that there is some kind of microchip, nanotransducer to control the population, particularly for people of ethnic minorities? I'm going to give you 2-3 seconds each to say something. I'll start with Dr. Chris.
Thank you, Pastor. Let me leave you with this very, very important scripture. Philippians chapter 4, verse 8. It says, finally, brethren, whatsoever things are true, whatsoever things are honest, whatsoever things are just, whatsoever things are pure, whatsoever things are lovely, whatsoever things are of good report, facts, factual, these are the virtue as a Christian. These are the things that you should pass across and spread. Please, 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 I plead with you, go get your vaccines. There's no 666 in it. There's no beast in it. There's nothing to control your brain or to control or change your DNA. Purely message that's been coded basically for your body to respond and bring immunity to fight infection. Thank you.
Thank you, Dr. Wale.
All I would say is that whilst there is technology available for microchips, these are not microchips that are in these vaccines. This pandemic is worldwide, it's affecting every nation, government, economy, and no one has the time for trying to make microchips for vaccines. That's not true. There are patents out there, but some of the patents now haven't been approved around conspiracy theories about microchips. So yeah, the answer is no, no, no.
Thank you. And of course, Dr. Tayo. No, you've already said that, Dr. Ronke.
Thank you, Pastor. I just want to read this scripture as well. Proverbs 17, verse 22. It says, a merry heart doeth good like medicine. This is medicine. It's medicine that God has given us, has given people wisdom to get in a time of a pandemic, which we know is not from God. We know that this pandemic is from the devil, because the devil comes to kill, to steal, and to destroy. So there's been a lot of destruction, there's been a lot of killing with this virus. And God has given people wisdom to bring a vaccine that can stop this. So please, it is good to be concerned. Nobody's asking anybody to foolishly just accept everything, and people are saying that this is to control the BAME community, but we find that it is mainly the white community that is taking the vaccine, and they're taking this opportunity to immunize themselves and to keep themselves safe. So why wouldn't we, as the BAME community, go and get this vaccine and take the medicine that God has given us through wisdom that he has given unto people, and protect our community and protect our elderly and protect our vulnerable people as well. So I would encourage everybody, no transducers, no microchips in this. This is medicine that do it good, and the wisdom has come from God for a time such as this. So yes, please go and take your vaccine. Thank you.
Amen. On this subject, and we still have a few minutes, so we can still do a few things. On this subject, there is a question. It's actually 2-3 questions that are coming back on line from our viewers as they are watching this program right now. And generally, the question is like this. I'll try and tie all the questions together into one. Is it possible that the COVID vaccine can and will be used as a gateway to what is called a COVID passport? Something that says you can't travel without the vaccine and have a passport, COVID passport. And eventually, so, okay, the vaccine doesn't entail a microchip or nanotransducers. But from the COVID passport, somebody's asking, people are asking, what if it now progresses from a COVID passport to now become a matter of eventually a chip, some kind of chip representing the mark of the beast? So, okay, I get it. I'm not having the vaccine now. I get the vaccine now. It's not the mark, but it goes on to the COVID passport, from the COVID passport to some kind of microchip. Dr. Wale, would you speak to that for us?
I think we need to understand that the idea about vaccine passport is not new. We used to have I can remember clearly, the yellow fever vaccine passport. And I think in modern medicine, it's important that we know or where to access individual medical history, for example, allergies. But not only that, I work in the safeguarding field, and there's a need to safeguard children in homes. So if the ambulance, the 999 is dialed, and the ambulance needs to go to a home, something comes up to say, this is what's in that home, this is what we need to do. Now, in terms of the vaccine passport, my opinion, it's inevitable, it's going to come, but we need to make sure we contribute to the discussion and the conversation around this so that we get it right from the start. It's likely that it's going to be needed to move around, but they're still in the early stages.
Thank you. But you don't believe the vaccine passport, which to you it appears it's inevitable, you don't believe it's going to end up progressing towards the chip of the mark of the beast?
Not the way the conspiracy theory around it has been spread.
Thank you. I remember, Dr. Wale, when I was traveling a number of years ago, and I forgot my yellow card. It's like a yellow passport where you get the yellow fever vaccination. It's stamped and marked, and the date in which you got it is put on there. And then I think your tetanus jab as well. And I remember I got to the country, I'd flown across the world, and they didn't allow me in. They said, well, you don't have your yellow card. We won't allow you in. That's for yellow fever. And so I can imagine it's inevitable, Dr. Wale, that there will be some kind of documentation of people who have taken the vaccine and those who have not. We have a few more questions, and we still have a few more minutes that we can answer them. For example, Dr. Wale, back to you. Dr. Wale, don't go yet. Will the vaccination, in your opinion and experience as a clinician and as a physician, will the vaccine be mandatory in the United Kingdom or even globally eventually? What's your thought on that?
I don't think there's a chance for that. We know that it's important to get people's consent. It's important. All my career, I've been learning how to explain and break news and try and get people on my side to get treatment. same thing with vaccines. The same thing I was doing in my immunization clinic. No one's going to force you. It's not in the interest of any government to force or mandatory demand that people get vaccinated. But like we've all said on this program, all the panelists, it's for your good. It's for the best interest of your children in the future. So you need to take the facts, wait, and make a decision on that.
Thank you. Dr. Chris, there are all these vaccine brands, Russia, China, America, Pfizer, ZN, all these vaccine brands. Which one should a person take in this matter?
Thank you very much. You can take any of the vaccines. It doesn't matter, as in whichever one the UK government has made available to us. Most of these vaccines, they work almost in similar ways, basically. And I will quickly explain the way they work. Like we've said before, they are messenger carriers. They are like booklets that contains informations. And the information is very simple. COVID-19. Those vectors or RNA or protein, as we like to call them. And it just basically means once they get into your system, your immune or your cells fight infection, recognizes those proteins, and then build immunity against those proteins, so that subsequently in future, if you come in contact with any of those viruses, your immune is already activated. They're already lengths basically to fight such viruses, and that's the way most of them actually works. In the UK, we've got the Pfizer, we've got the AstraZeneca, and now we've got the Moderna. Basically, both of them are 2 shots. I mean, three of them are 2 shots each. You have one, and then about 11 to 12 weeks later, then you have another one. So it doesn't matter which one is available. Just take whichever one. They're both effective. They both say they're all safe. They're all effective. They will do what they say they will do. It's a matter of logistics. It's a matter of procedures. Some of the vaccines, they have to be stored in a very, very ice environment, especially the Pfizer one. And what we notice is that they're not that very common anymore in primary care. So you have them in secondary care. You have them in max vaccination center. But in primary care, in the surgeries, is the AstraZeneca that has been given to us. And the reason is because we don't have the facility to store such at minus 70 degrees. So the AstraZeneca and the Moderna, you can store them in any degree basically, and you will still be fine between 2 and 8. So take whichever one is made available to you. Very safe, very, very effective. Thank you.
Wow. Dr. Tayo, Dr. Chris is telling us that really and truly, whichever vaccine is available to you, just take it, and is encouraging it. But somebody is asking the question, a lot of these viruses have been developed using human tissue, fetal tissue. Isn't that even unethical? Is that even Christian? Are you supposed to do that? Or as a virologist, what would be just a few seconds to comment on that?
Okay. So what I'm going to do now is I'm just going to try and watch what I say, so that it doesn't lead to further questions or misconceptions. To start with, viruses cannot survive independently. It's always been in the news. Viruses need the human host to survive. So that's something we need to know. And in years past, viruses and vaccines have been made using cell lines to make more copies of the cell lines, like the vectors I mentioned for the Johnson & Johnson, the AstraZeneca. So yes, fetal cell lines were used, But these were cell lines that were obtained years ago, not recently, and they were propagated over years. But I need to say this, there is no fetal cell in itself inside the vaccine. They were all washed away. So it was just the pure genetic biologic material of the vaccine material that are in the vaccines being given out. Like I said, I'm actually struggling to try and use the right word so that I don't get people more confused. But that's just as viruses cannot survive independently. Other cell lines, which are not even human, are used to propagate and produce more of this vector. So, but yeah, like I said, yes. But like, I just want to say something that would get people more confused. Yeah, but there's no fetal cell inside the vaccine. Yeah.
Yeah, if I make it more personal, Dr. Tayo, as a Christian and as a believer, passionate believer, and it's a yes or no question, do you have any matters of figures of conscience that the way these vaccinations are produced are unethical in any way?
For me, I have my own personal opinion. I have nothing against the ethics about making the vaccine. The fetal cells that were used were probably obtained maybe 30, 40 years ago. And they were maybe from spontaneous abortion, whereby, the pregnancy, the person lost the pregnancy, or it was not maybe because of, abnormalities in the unborn child. So I do not personally, even as a Christian, at the end of the day, there's something I always have in mind for the greater good. And like I said, there is no fetal cell in the vaccine. So nobody's been injected with a cell of an aborted fetus somewhere there, or, it was cleared, it was purified. And these were cells that were obtained years ago, not like the baby was just aborted 2 days ago or a month ago. No, it was like years ago. And like I said, cells cannot independently multiply. They need a vessel, and cells are vessels whereby, the viruses are, the cells and the viruses, when they're put together, then the cell will now act as a vessel to help in amplifying and multiplying the vectors that are used for vaccine manufacturing.
Thank you. Dr. Wole, I have a question for you. COVID-19 is being used, somebody said, is it being used for Agenda 2030, which is the beginning of the enslavement of humanity? And I don't say that in any sense to ridicule or undermine the sincerity of the question, that there is some kind of Agenda 2030 and it's for the enslavement of humanity. Is this fact? Is this fiction? Is this science? Is this conspiracy, in your view?
I must say I've found no evidence of that theory. All I can say is that I know there is an Agenda 2030, and that was an agenda agreed upon by member states of the United Nations in 2015. And there was a number of goals, which included making sure that poverty is eradicated around the world and no one goes hungry, reducing inequality, and so on. And I think, if I remember, having watched one of these videos online, they were talking about that this is a plan to kill 6 billion people over the planet so that, there's less hunger in the world. No chance. I don't think that's correct. I think these are set goals. I think they are really good goals. This is the watershed period where we're looking into all lives matter, reducing inequality, sex inequality, and all that. And it's these are good goals if you go back and look at that agenda. So will be my response to that.
Go ahead, please finish.
Yeah, that's it. That's my response. There's no conspiracy around that at all.
Thank you, Dr. Chris. what would be your advice or your counsel? We only have about 4 or 5 minutes left, but I want to get through as many of these questions as we can. What would be your advice, Dr. Chris, to someone who's nervous or jittery about taking the vaccine? Somebody sent in a question online as we were speaking, saying, well, Dr. Albert, what about using alternatives apart from the vaccination, like hydrochloroquine or zinc and a few other treatment modalities that are being peddled out there? Can I use alternative treatment instead of the vaccine?
Thank you very much. I think the first question I would like to ask is what's causing the the nervousness about the vaccine? Because then when you have an answer to that, you will be able to give a proper answer to the person. But I'm going to take it in a general context, basically. Theologians or people will know that nothing can be eaten to take. You've got to be aware of it. Basically, it cannot be hidden from you, and that's, if that is what is causing the nervousness, that will actually answer that. Now, when it comes to the issue of hydroxychloroquine, now there are data, there are statistics, evidence that have shown that yes, it works in certain cases, but not in all cases, basically. It's also very important to know that the response to it, basically, it's very, very short-lived. It cannot last. In fact, your body do not booster immunity based on hydroxychloroquine. It's the hydroxychloroquine that works itself, and it will be metabolized in the body. And how quick does hydroxychloroquine is metabolized? It's just a matter of days. Basically, your kidney will flush it off completely, so it does not last. So that answers the issue of using hydroxychloroquine rather than the vaccination. There are no alternatives at the moment to vaccination. And you need to understand that God has not given you the spirit of fear as well. So take that. Your reason for not wanting the vaccination must not be based on fear. It must be based on facts. And facts has been provided by all this group of panelists basically tonight. Go take the vaccination is the answer. Not just for yourself, but for your older people, for the elderly people, for those that are unwell, for those that have one issues or the other that needs to be protected. So majority of us that take the vaccination, sometimes not for ourselves, but also because of people we come in contact with. Go take the vaccination. Thank you.
Thank you. And then we have just 1 or 2 last questions, because gosh, time has traveled so fast. Thank you so much, our distinguished panelists. You've been an amazing blessing and very professional and well informed about answering the questions. I have a question here, and it's going to go to, I think it will go again to Dr. Tayo. It's a short one, but I think it's important. And I'll probably double up the question because there are a few questions that are coming in online as well as we're talking, apart from the ones I've already got, which says that what's the volume? I have no idea why this person is asking this, but what's the volume of the vaccine that's actually injected into the muscle each jab? Then the persons are also asking, so I'm doubling up the question, Dr. Tayo, and they're saying, is it going to be like the flu jab, meaning that we get jabbed for COVID-19 vaccination now, and then a year from now, we have to get the jabs all over again? Is this going to be like the flu jab?
All right, thank you. So I would like to start by saying I don't know the volume. But it has to be based on the package inside, based on the instruction of the manufacturer. But I'll leave it open to the other people on the panel if they know the volume of the vaccine. I mean, the volume of the vaccine I'll be given. But looking at the issue of, is it going to be a routine yearly vaccine like the influenza vaccine? Nobody knows at the moment. Like Dr. Chris Olukonyi said a while back, the duration of immunity. We are still learning. For the vaccine immunity, we are looking at, the latest study shows is about 4 months, because we just started vaccinating anyway. Then for natural immunity, it can go on for as long as 6 to 8 months, almost 8 months. But like I said earlier too, we don't know the depth of immunity, the breadth, and the strength of immunity. So as time goes on and new data comes in, we'll be able to know if it's going to be something that's going to be yearly or twice yearly, because we are still trying to learn if the infection, the COVID infection itself, is going to be a seasonal thing. Like here in South Africa, the first wave was during winter, the second wave was in summer. So there's a lot of unknowns about this issue of COVID. So we don't know yet. And even with the new the South African so-called strain, it just came out this evening that it produces more neutralizing antibodies, and probably the pharmaceutical companies will probably tailor the vaccines based on this South African strain, because it's been shown to neutralize more strains than the other COVID strains. So data and time will tell all this. Thank you.
Thank you. Thank you very much. Does anyone want to add to that, who may know the volume of the injection?
Yes, you've got the AstraZeneca, which will be given as 0.5 mils, again intramuscularly, and you've got the Pfizer, which is going to be 0.3 mils intramuscularly as well, and you've got the Moderna, which is going to be 0. Single shot. Then you have the other one about 11 to 12 weeks later. Very, very minute, very, very small. You will hardly actually even feel the prick, to be honest with you. Thank you.
Thank you. I have no idea why that question was asked, but I want to really thank all of our panelists today. Thank you so much for being such an immense blessing, and also for sacrificing your time to speak to us as a people, ethnic minorities, Blacks, Christians, and non-Christians as well, about a global pandemic that is a concern to governments around the world. It's changed our world in a very significant way, and hundreds of thousands of people have either died, mortality, and millions perhaps in morbidity in terms of sickness and pathology and so on. And I thank you so much for being so concerned enough to give your time to be a part of this roundtable conversation today. I am going to tag on you a little bit more and give each one of you, we've run out of time. Thank you so much, our viewers, for sending in questions, for participating and being a part of this meeting tonight. But I'd like to ask our panelists to take 20 seconds, 20, 30 seconds. What would be your, if I would say, last word to everyone who's viewing tonight? What would you say to them with regards to taking the COVID-19 vaccine, regardless of the brand? So I'm going to start ladies first. So giving honor to whom honor is due, I'm going to ask Dr. Ronke, what would you say if it was just your last few seconds to talk to everybody everywhere in the UK and around the world?
Thank you very much, Pastor. I will say what we've all been saying on this panel this evening. Please take the vaccine, regardless of whichever brand that you're offered, whether it be the Pfizer, the AstraZeneca, or the Moderna, or whichever other ones come in. Like everybody has said, this has gone through regulatory bodies, so it's been looked at in terms of safety, in terms of being effective. And one thing I would just like to add is that you have to think about why some people are so bent on these conspiracy theories, and actually think about the source of these conspiracy theories and think, is this the way that God works? Is this the way that God works? Projecting fear. We know that fear is not from God. We know that fear is a tool of the devil. So anything that stirs up fear and stirs up a lot of anxiety is not from God. So please, brothers and sisters, I encourage you, take the vaccine. I've taken mine. I'm fine. Nothing's happened to me. I'm well. Bless you.
Thank you very much. Thank you so much. I'm going to ask Dr. Tayo, all the way from South Africa. What would you say to us in England, in South Africa, and from all over the world where people are viewing this? What would you say?
Okay. I got vaccinated today in the afternoon, so I've got some slight pain. I think Dr. Ronke mentioned that, which is expected. I mean, it's a needle, but it's slight, a bit of swelling. So I'm looking to the future to contribute to the herd immunity and try and drive down this pandemic. And I'll continue using my face mask and, hand sanitization and social distancing, at least for now. Then the reason is because, like I said, there's a difference between infection and a disease. So me being vaccinated will probably, most likely prevent me from having severe disease. But that does not mean I cannot be infected. And if I'm infected, I can infect someone else who's more susceptible to having severe disease, who has not been vaccinated, and that might lead to the death of that person. So I will encourage everybody to try and trust WHO, look through the website, look through FDA, CDC websites, and I'm sure I don't know which websites people look at in the UK. Look at these websites too, and just look at those things and critically look at science. This is just basic science. It's not conspiracy theory. And I just wish that things will all go back to normal pretty soon. Thank you very much.
Thank you. Thank you. Dr. Chris Olukani, as someone who has vaccinated tens of thousands of people, and as a clinical director, as a Christian and a pastor as well, what would you say to us in just a few seconds on this matter?
Thank you, Pastor. Again, just like others have said, I've had my 2 vaccination, and I can see myself on the screen. I don't have 2 horns grown, and that is never going to happen. I am still passionate about God and in love with Christ. What I would like to say is that there's always going to be conspiracy theories when it comes to development and technology. When people started using pins and chips on their bank cards, there's a lot of conspiracy theories. When electronic passport came up,
Okay. Pastor Chris we've lost him for a few seconds. Are you still there?
Thank you.
We'll double back to Pastor Chris in a moment, Dr. Chris. While we're trying to fix that glitch, I'm going to ask, of course, are you back now, Dr. Chris?
Yes, I'm back.
Yes,
sorry about that.
Okay, go ahead.
So
Yes.
what I was trying to say is that every new technology will bring about stories about conspiracy theories. We spoke about it when we had the bank cards, when we have electronic passports. So every new technology will bring about that. Let's get ourselves vaccinated. Thank you.
Thank you. And of course, last but certainly not the least, Dr. Wale Oshoba, what would you say to us as a last minute comment on this particular subject?
Thank you, Pastor. I would like to leave everyone with this description of the vaccine process. Someone used this analogy before, and I thought it was a good way of getting across. So we need to see it as an armed bandit telling you, I'm coming to rob your house. And then what you did was to get a security man to check all your locks, check all your systems, your alarm systems, to make sure that when the bandit comes, they can't come in. And so the vaccines, what they do is prepare our bodies for the day where the virus wants to come in to take over our bodies, to take over our house, to kill us. So that, and if you take a second vaccine, basically what you're doing is calling the security man to come in to double check what you've done to make sure that you've done the right thing. And then you know you're safe. You're safe for your children. You could enjoy your life. You could go on those holidays that you want to go for, and you could fulfill destiny.
Thank you, Dr. Wale. I want to thank all of our panelists for an outstanding hour and a half of enlightenment, education, and encouragement to do what is important. I have, as a person, always believed that God uses the medical profession to save lives. I studied medicine many years ago. I don't practice any longer. I haven't for decades. But I learned in medical school that this clearly is a science given to man by God, and knowledge to save lives. In an acute appendicitis case, we would rush our family members to the hospital, and the doctors would rush them into the surgery and open them up and take out the inflamed appendix, and then patch them back up, sew them back up, and put them on antibiotics, and they come out a few days later smiling. And we don't consider conspiracy theories when they come back alive and well. And like the great man of God, Frederick Casey Price, the author of The Teacher of Faith, once said, that faith and foolishness, you must find the balance between the two. I generally believe, and I thank God our panelists have confirmed that science is given to us by God to save lives. And if we had this vaccine a year ago, we wouldn't have as many deaths recorded globally. And the thing about it is, Christians have died, Muslims have died, heathen have died, atheists have died, young and old, black and white, or suffered severe morbidity. So the truth be said, these are lovely people, good people, wonderful people who are alive to be a blessing to their generation that were lost to this terrible viral pandemic. Now that we have finally been given this vaccine by God, God gave that information and knowledge. I believe, I recommend, I encourage with all of our distinguished panelists that if you have access to that vaccine, take it. It doesn't make you any less a Christian. It doesn't mean you don't have faith. I have traveled around the world before I got my first jab of the vaccination. I traveled by faith. I social distanced. I washed my hands regularly. I put on a mask, and I did what I needed to do because I believe in faith and God's capacity to protect us. But when the vaccine became available, I took the vaccine, and I didn't take the vaccine in fear. I took it in faith, just the way you would pop a paracetamol tablet, not in fear, but in faith as well. And remember, this year, 2021, God has promised us that we're going forward. So make progress in life, get rid of the distractions, shame the devil, make an intelligent choice, and be everything God wants us to be. Once again, I double back to Dr. Tayo Famoroti, I double back to Dr. Chris Olukani, Dr. Ronke Olukani, and of course, Dr. Wale Oshoba. Kudos to you. The Lord bless you, keep you, prosper you, progress you, promote you, and give you more knowledge, wisdom, and understanding in your profession, apart from your Christian walk, so that you can continue to be a blessing to the world around you. To all of you watching at home and around the world, thank you for tuning in, and don't forget to share, to care by sharing, put in your comments, and send it around the world. You are amazing. We love you, and you are the reason why we do what we do. I'm going to hand over now to our resident pastor, Dr. Timothy Rabio. Pastor Timothy, over to you. God bless you.
A fantastic, very informative and impactful information that we just had. Thank you once again, echoing what Pastor has said. Oh, wow. They say knowledge is power. We have received knowledge, which means we have been empowered to make a decision. My prayer, I will quickly quote James chapter 1, verse 16 and 17. It says, "Don't be deceived, my dear brothers and sisters. Every good and perfect gift is from above, coming down from the Father of the heavenly lights." Ladies and gentlemen, medicine is a gift from the Father of all insights. It's given insight, and I pray that it will have given us, every one of us, insight into this vaccine. I will make the right decision. But before we round off, it's going to be an opportunity for us to, from the generosity of our heart, give towards the work of the ministry. We are not making a demand of us, but we're asking you as a way of gratitude to the one who has preserved us, kept us, fought our cause, healed us, kept us through all the challenges of the past months. Let's honor him. The Bible says we should honor God with our first fruits. So today, I want to ask every one of us, as we round off, a video will be shown to us immediately that will show us how we should do so. Please, I know that our God, he is faithful not only to keep, but also to bless you. May you see God. May he show up on your behalf, and may he multiply your seed exceedingly. Thank you, and hope to see you once again as we bring yet another session of seminar to inform us. Good night. And
steps to make donations to Glory House. Step 1. To make a donation via the website at gloryhouse.org.uk, simply click the Donate tab and fill the amount you would like to donate. Fill in your details and click Donate. Step 2. You can donate via the Watch Live page by clicking the Donate tab, which will take you to the donation page. In Step 3, you can also donate via the PayPal URL at www.paypal.me/gloryhouselondon and fill the amount you would like to donate.